Pregnancy belly, mommy tummy, mommy pooch, whatever you want to call it, diastasis is a common issue that many people struggle to correct because we've been lied to. Okay, maybe not actually lied to, but incredibly misinformed. Chances are you have been told that diastasis is a common issue related to pregnancy, but did you know that diastasis can affect infants as well as men, not just pregnant women? Diastasis recti is a whole body issue that is often defined by its symptom, which is why so many people fail to heal their diastasis and regain functional strength and muscle tone in their core. Diastasis is not a condition affecting the abdominal muscles themselves, but rather it's a condition resulting in the unnatural separation of the rectus abdominis, which is your most superficial abdominal muscle. And that separation is caused by damage to your linea alba, which is the connective tissue that holds the two halves of your muscle together. Now, I emphasize unnatural separation because each of us has a natural to me distance between the two halves of our rectus abdominis. And also because pregnancy is a natural occurrence within a woman's body, and it is natural for there to be some separation that goes on between your abdominal muscles. So if you want to truly heal your diastasis and regain muscle strength, then you need to better understand what caused the unnatural separation of your core in the first place. Now, if you've been trying to heal your diastasis merely by focusing on corrective exercises targeting the muscles themselves, but you haven't been able to regain that strength or that tone, it may be because your well-meaning physicians and gurus have failed to recognize what actually caused the symptom of your diastasis in the first place, and the exercises that you were told to do may actually be causing more damage. So let's talk about the root cause of diastasis. If I asked you to describe the parts of an orange to me, you might accurately describe the rind, the pith, which is the connective tissue that actually holds the rind to the orange itself. You might also describe the meat of the orange as well as maybe the pockets of juice. But most people would fail to recognize the unseen element that makes up an orange, and that is force. See, if you were to slice into this orange or to bite into it, the juice would squirt out, revealing that the juice was under pressure the whole time. The same is true with the contents of our core. It's constantly under pressure, and the pressure changes depending on the activities that we do every single day. And like the orange, our core is made up of visible contents like the muscles and the guts and maybe a growing baby and possibly, although hopefully not, visceral fat. But it's also composed of some invisible things that you can't see, like force, just like with the orange. And as an aside, before we get too far into it, because this video is not designed to be focusing on how to lose abdominal fat, but if you are struggling with excessive weight and you're looking for a healthy way to lose the weight and keep it off for good, then I am going to leave a link in the description box below where you can check out my favorite streaming service for home workout. It also includes a library of hundreds of delicious recipes designed to nourish your body while you work out without making you feel like you're dieting or missing out on your favorite foods. Merely focusing on corrective exercises targeted at your muscles without addressing and correcting the inappropriate forces being applied within the abdominal cavity itself will only lead you to have to readdress the symptom of diastasis and other pressure-related conditions over and over again without ever truly correcting the issue. Now, when you think of your abdominal cavity, it helps to think of it as a balloon sandwiched between two other balloons. Now, in the middle, you have your abdominal balloon, okay? And on top of it sits your thoracic balloon, and below it sits your pelvic balloon. If the pressure in your core changes in the wrong way, the forces within your abdomen will apply pressure to inappropriate structures. So how do we misapply these forces? Well, to understand how we misapply these forces, you need to have a little bit of understanding of some basic anatomy. So if you don't know, your linea alba is a band of connective tissue. You can kind of think of it as taffy that attaches to your rib cage via the sternum and to your pelvis via pubis symphysis. So anytime you move your rib cage or your pelvis, if you tuck your hips under or if you rotate them forward, if you shift your rib cage, if you're reaching, anything like that, it applies different force by tugging and pulling on the linea alba. Now, your linea alba also serves as the main connecting point to just about every other abdominal muscle that you have, the internal and external obliques, your transverse core, your abdominal aponeurosis. All of these muscles and tissues connect to your linea alba, and these muscles connect. They're interrelated, kind of like a wicker basket. Some of them are deep, some of them are superficial to each other. Others dive over and then under, so they're really like a wicker basket. So any movement that you do changes the pull and the tug and the force of your abdominal cavity. Now, because of the many points of connection to this connective tissue, linea alba sustains various degrees of pressure via pulling and tugging from everyday activities and or a growing baby. So now I want you to think about the various positions that you assume every day. from posture, from slouching to leaning to sitting in your car in your commute. Maybe you rest your arm on this, maybe on the center console or maybe on the door or whatever. These are all natural movements. You think about, reaching overhead to get something on a high shelf, or turning behind you to give something to your kids in the back seat. All of these movements are natural, and we are designed to move in these ways. So while the movements that you're doing may be natural, what may be unnatural about the movements is the rate at which we repeat them and or the condition of our tissues which are unable to sustain these movements. If you've ever had a hair tie that you used every day, all day, you know that over time, the integrity of that elastic band is degraded. And over time, it will eventually snap. Or maybe you've had a sweater that you always would roll up your sleeves. And in the beginning it was fine because you would pull it back down and the cuff would snap back to its original size. But the more you would stretch it, right, the rate at which you would do that thing, the elastic in that sweater is designed to stretch. It can go over your arm. But as you do it day after day after day after day, eventually the integrity of that elastic, it degrades and it no longer snaps back to its original size when you pull it back down, right? Well, that's the same thing with our connective tissues. Our modern society is increasingly sedentary. Our muscles and our tendons and our ligaments don't get the right kind of movements or nutrients to keep them strong. Because our bodies aren't receiving the right kind of movements or nutrients to keep them strong, our tissues are incapable of keeping up with repetitive stress that we place on them, even from natural movements. And thus, as a society, we are finding ourselves more vulnerable to soft tissue injuries and repetitive use injuries. So going back to DR and the illustration I gave of the 3 balloons, when inappropriate pressure is applied downward from the abdominal cavity, somebody might experience something like prolapse or hemorrhoids. But when inappropriate pressure is applied upward, it can actually push your guts up into your thoracic cavity. In the case of diastasis, like what we're talking about in this video, the pressure is applied outward, which causes so much damage to the linea alba that it actually tears, which allows for the unnatural separation of the 2 halves of your rectus abdominis. So the key to truly healing your diastasis recti or any other pressure-related condition is to learn how to manage the pressure within your abdomen during everyday movements, and especially if you're working out and you add weight, you add that load, you have to know how to manage the pressure that's already within your abdomen. The answer is not to stop moving, and it's certainly not surgery. It's to learn how to move with greater intention and control. Now, if you're interested in diving even deeper into understanding diastasis recti, I highly recommend that you get your hands on a copy of Katy Bowman's book, Diastasis Recti, The Whole Body Solution to Abdominal Weakness and Separation. Katy is a biomechanist with several books and a podcast, as well as an online membership to teach you nutritious movement. I will be sure to link those resources down in the description box below, along with my favorite streaming service for my favorite home workouts. Now, if you don't care too much about the technical science about fixing your diastasis, and even if you do, please don't forget to subscribe and hit that notification bell, and watch my next video where I am going to teach you how to heal your diastasis forever without doing a single exercise.